Today, we'll be talking about post-traumatic stress disorders. People who have fought in the Vietnam can be diagnosed with post-traumatic stress disorders, and people of all ages can be diagnosed with post-traumatic stress disorders as well. Veterans who are diagnosed with post-traumatic stress disorders are typically diagnosed after a shocking or terrifying or dangerous event that they saw happen. There are multiple symptoms that a person with post-traumatic stress disorders could get, which are like nightmares, memories of a specific trauma, anxiety, or a depression mood. Some of the causes of post-traumatic stress disorder are like serious physical or sexual assault, abuse, including childhood or domestic abuse, exposure to traumatic events at work, including remote exposure, serious health problems, such as being admitted to intensive care, childbirth experiences, such as losing a baby, war and conflict, and even torture. I think that the best solution for a person with post-traumatic stress disorders is to get a service dog that will help them lessen the trauma associated with triggering events in public. These dogs are taught behaviors that help people with post-traumatic stress disorders see better cope with fear and anxiety. People with post-traumatic stress disorders are also estimated that 80% of the time individuals who have post-traumatic stress disorders are also diagnosed with another disorder as well. The common disorders are major depression, bipolar disorders, adjustment disorders, personality disorders, dysthymia, anxiety disorders, substance use disorders, and alcoholism. There could be a lot of negative changes in their thinking and moods that people with this disorder have. Some of those negative changes in their thinking and moods are like hopeless about their future, having difficulty maintaining close relationships, lack of interest in activities you once enjoyed, and feeling emotionally numb. A couple more are like having negative thoughts about yourself or people or even the entire world. Memory problems are also including not remembering important aspects of a traumatic event, feeling detached from family and friends, and difficulty experiencing positive emotions. Some physical and emotional reaction changes that people with post-traumatic stress disorders can get are easily startled or frightened, self-destructive behavior, such as drinking too much or driving too fast, having trouble concentrating, being overwhelmed with guilt or shame. Some other changes are always being on guard for danger, having trouble sleeping, irritability, angry outburst, or aggressive behavior. The symptoms of post-traumatic stress disorders don't just fade away over time. These feelings intensify until the person is overwhelmed and is unable to function. According to Suzanne Latica, veterans who have PTSD can struggle with mental health issues, including suicidal thoughts, and can have an addiction and can even end up homeless. Overall, I think that people with PTSD should get to enjoy their life and not have to suffer from nightmares that they have because of something terrible that happened that they experienced. And if you have a loved one with PTSD, you should spend more time with them and do fun things together, like go out and do something fun. PTSD is something that you can get somebody out of, like thinking something bad, like do something fun and don't take them to places that will affect them. And that's all for today.